Welcome to the Mortuary Masterclass, brought to you by the Champion Company, where preservation meets purpose and every step is part of your journey to safer solutions. In this episode, we're talking about something that's been quietly reshaping the profession: natural green burial and eco-cremation in disposition. We're not looking at, not as a trend, not as a critique, but as a natural next milestone. Because embalming has never been static, it's always evolved. If you've been in this profession for any length of time, you already know that. What we do today isn't what was done 50 years ago, and what we'll do 10 years from now won't look exactly like today either. That's not disrespecting tradition. That's honoring it. Formaldehyde deserves respect. It built the modern funeral profession. It gave embalmers consistency, control, and time when families needed it most. It was the foundation, the bedrock, and without it, we wouldn't be standing where we are today. But every foundation eventually supports something new. And the next phase of this profession is about safer solutions. Many factors are involved. Today, families are asking different questions, regulations are tightening, exposure awareness is higher, and embalmers are becoming more intentional about what part of the job really needs to mean. That's where eco-balming enters the conversation, not as a rebellion, not as an overnight replacement, but as an on-ramp. At its core, modern eco-balming is about using chemicals and procedures that are non-toxic, non-hazardous, have an ultra-low environmental impact, and are biodegradable. They also need to be effective enough to do what families are requesting and to fulfill the modern tenets of embalming, which are public safety, temporary sanitation, cosmetic restoration, and temporary preservation. Implementation of eco-balming requires new thinking, new procedures, and new alternative chemicals. And since this part matters, let's examine it more closely. Eco-balming is not designed to stop nature. It's designed to slow it. The intent is temporary delay, not permanent suspension. With proper application, chemostasis happens quickly. Decomposition begins to slow almost immediately after injection, infusion, or topical use. In most cases, effective holding is achieved for 3 to 5 days. In some situations, especially with supplemental refrigeration, possibly a week or a bit longer. And for the majority of families, that's enough. That window allows time for planning, transport, viewing, and meaningful end-of-life ceremonies, without introducing unnecessary toxicity into the prep room or the environment. Think of it this way. Traditional embalming hits the brakes hard. Eco-balming eases the speed down smoothly. Same road, different driving styles. Now let's bring this back to the prep room, because philosophy only goes so far without practicality. In natural or green burial situations, embalmers consistently face 4 real problems. The first is leakage. Blood, fluids, and other exudates don't stop just because embalming isn't requested, and the concern is real. No one wants to worry about what might escape a wicker casket, a fiberboard container, or at a home funeral setting. This is where Enigma compound shines. It absorbs and deodorizes at the same time. It can be used to create a leak-proof bed with natural sheets packed into undergarments or made into sachets using pillowcases. It's simple, it's dignified, and it works. Even when a family requests no embalming at all, these measures are justified. They mirror cleansing and preparation practices used across cultures worldwide and are not viewed as invasive or disrespectful. The second issue is odor. Decomposition odors are unmistakable, and once they're present, everyone in the room knows it. Enigma Topical addresses this directly with strong deodorizing and sanitizing action. Applied as a spray during cleansing, poured into absorbent compound, or used as an anointing treatment over the body, it controls odor at the source rather than masking it. Sprayed onto compound, it creates powerful deodorizing pillows or bedding that are completely non-invasive. The third challenge is gas buildup and purge. This is where things can escalate quickly. Roughly 90% of decomposition-related problems begin in the cavities. Gas formation is inevitable, and purge is a real risk. Enigma Cavity is designed to address exactly that. American-style cavity treatment, with aspiration followed by cavity fluid, is the most aggressive option. European-style treatment skips aspiration entirely and introduces the solution directly into the cavity. Families are often more receptive to this when it's explained as a minimally invasive, essential oil-based treatment designed to temporarily slow natural processes. This approach is widely accepted overseas and increasingly accepted here when arterial injection isn't desired. And finally, the fourth problem is appearance. In certain cases, a body that hasn't been embalmed doesn't require additional intervention. Others do. Trauma, disease, and delays between death and burial can create a presentation that's difficult for families. Enigma Arterial allows for blood clearing and creation of a background cosmetic effect that minimizes the unappealing aspects of a dead body. Sometimes as little as 1 gallon is enough. Sometimes 2 or 3 are needed. The guiding principle is simple. Use what achieves the desired effect. Arterial, then, if and when needed, will be accepted by some natural green burial families, but not by all, as an acceptable treatment for solving what would otherwise require a non-viewable, closed casket situation. This brings us to one of the most important concepts in ecobalming: hierarchy of use. Enigma. Compound and topical sit at the foundation. They are practical, universally acceptable, and rarely questioned. Cavity treatment occupies the middle ground, offering effective control with minimal invasiveness. Full arterial embalming becomes the least requested option in natural and green settings, not because it's wrong, but because it's often unnecessary. That shift takes new thinking. And yes, a little unlearning. Ecobalming also clearly defines what no longer aligns with modern standards. Traditional chemicals like formaldehyde, phenols, methanol, glutaraldehyde, iodine releasers, chlorinated solvents, petrochemicals, and VOC-heavy compounds are not compatible with natural or green care. Neither are plastic eye caps, wire mouth formers, synthetic sutures, plastic garments, or glue-based closures. Instead, the roadmap moves toward natural fibers, cotton and linen sutures, gentle soaps, aloe-based cosmetics, absorbent compounds, essential oil-based cavity treatments, transparent chemistry, fully disclosed ingredients. Even in autopsy cases, ecobalming offers approved alternatives: immersion packing of viscera, hypo-injection where needed, natural cotton for bulk, cotton sutures for calvarium attachment, sealers designed to dry without releasing toxic vapors. If this sounds different from how you were trained, that's okay. That's what evolution feels like. And at the heart of it all is transparency. No mystery ingredients, no hidden trade secrets. If it's used on a human body, embalmers deserve to know exactly what it contains and how it behaves during preparation and disposition. Ecobalming doesn't erase traditional embalming. There will always be cases where it's appropriate. Long-term holding, complex restorations, specific family needs are all examples. What it does is expand the toolbox. It gives embalmers safer options. It aligns with where the profession is headed, and it allows you to move forward without abandoning the knowledge and skill you've already earned. If you're standing at that crossroads wondering where this fits in your practice, think of it this way. Pause. You don't have to leap. You just have to step onto the on-ramp. Learn the procedures, understand the hierarchy, try it on the right case, pay attention to the room, the air, the workflow. This isn't about rejecting the past. It's about building the next milestone. And if you want to go deeper into the practical, step-by-step use of Enigma topical, compound, cavity, and arterial, and how to apply them confidently in real cases, check out our in-depth information located on our website. Thanks for tuning in to this special edition of the Mortuary Masterclass, championing the prep room with purpose, because embalmers matter, and every step forward is part of your journey to safer solutions. That's the champion difference.